Hello everyone, welcome to another video. This is Ischium Simplified. So let's begin with the topic Ischium. So ischium is a roughly quadrilateral plate of bone which is situated behind the pubis and forms the most part of the pelvic floor. So it has got two surfaces, four borders and four angles. Two surfaces, these are dorsal and ventral. Dorsal surface is concave, smooth. Obturator internus muscle is present, and ventral surface is convex, rough, and adductor muscle is present. It has got four borders that are anterior, posterior, lateral, and medial. So these are the four borders. Anterior is concave, thin. Posterior boundary of the obturator foramen is formed by the anterior border, and posterior is thick, ischial arch is present, and lateral one is concave, lesser ischiatic notch is present. Medial border, it consists of ischial symphysis, which forms the ventral tubercle. So this was about surfaces and borders. This ventral surface is slightly convex and rough for the origin of adductor muscle. The anterior border is concave and thin. So this is the anterior border, it is concave and thin. Next is, it forms the posterior boundary of the obturator foramen as it was told before. Posterior border is thick, inclined forwards. Posterior border is thick, it is also inclined forward, slightly inclined forward and forms the ischial arch. So this is the ischial arch. By joining with its fellow border. This lateral border is convex with lesser ischiatic notch, and medial border joins with the similar border of the bone of the opposite side. And this forms the ischial symphysis. So ischial symphysis is formed by the similar another bone with the other side. And if I talk about ventrally, at the middle of this symphysis, the ventral symphysis, at the middle of symphysis there is a prominence which is known as ventral tubercle, and anterior internal angle is narrow and joins with the posterior angle of the pubis. So there are four angles: anterior internal, anterior external, posterior internal, and posterior external. Anterior internal, if this is the bone, ischium bone, so if this is the ischium bone, this is the anterior external angle, and this is the anterior internal angle. This is the posterior internal and this is the posterior external. So how I name this angle as internal, this angle is internal, and this angle is external by locating the position of another ischium bone of the other side. So if I talk about this ischium bone, this is the internal part, this is the internal part, this is the exterior angle, anterior, external. As the animal is facing this side, so this is the anterior part or cranial part, or this is the posterior part, and this is the posterior external angle. So this last one will be posterior internal. I think now all the angles are clear. So anterior internal angle is narrow and joins with the posterior angle of the pubis. Anterior external angle is wide and joins with the cotyloid cavity. This anterior external angle is wide. Here cotyloid angle is formed with the fusion of three bones: ilium, ischium and pubis. And posterior internal angle meets the other bone at the ischial arch. So if this is the ischial arch, it meets with another bone. Posterior internal angle it meets with the posterior internal angle of the other bone. And posterior external angle is trifid. Posterior angle is divided with three projections, that is three parts or three projections. This is called ischial tuberosity or pin bone. If I come to this diagram here, so this is the ilium bone. Okay, this is the pubis part of the hip bone, and this is the ischial bone. So this ischial bone is a quadrilateral bone, as we talked earlier, and it consists of four angles. These are anterior external, anterior internal, posterior internal and posterior external. So posterior external angle is made up of ischial tuberosity, and this is the ischial arch which joins with the same half of the another bone. So at the ventral part, ventral tubercle is present, and when both the two bones join, it forms ischial symphysis. So this is the ischial symphysis. So this was all about this topic.